If you're over 60 and you've noticed changes in the color, smell, or frequency of your urine, this message is for you. It might seem like a minor thing, but your body speaks. And sometimes it starts by whispering through the places we least expect. Many women ignore these signs, out of embarrassment, or because they assume it's just part of getting older. But often, it's not. Today, as a doctor, I'm going to show you the 3 most important urinary signs you should never ignore, and what to do if you notice them. If this video resonates with you, give it a like, subscribe, and turn on notifications. Here we talk about health with respect, clarity, and deep care for the wisdom that brought you this far. Over a lifetime, we learn to put up with things. We push through pain, through fatigue, through discomfort. And far too often, we ignore the quiet signals from our bodies that something's not right. When it comes to urinary symptoms, it's easy to brush them off, to assume they're just part of aging. But that mindset, it can actually make things worse, not better. Yes, your body changes with age, but change doesn't mean neglect. After 60, the body starts operating differently. Your kidneys may become less efficient. Your bladder becomes more sensitive, and hormonal changes from menopause affect your urinary tract directly. That means even small symptoms can quickly become bigger problems if left unaddressed. And here's something most people won't tell you clearly. A lot of women do notice changes, but they don't seek help. Some believe it's just aging. Some are afraid of what they might discover. And others simply don't know what's worth worrying about. What we need is information and the courage to truly listen to our bodies. Your urine tells you a lot about your hydration, about possible infections, even about how your kidneys and bladder are functioning. But only if you're paying attention. It's like learning a new form of self-care, one that starts with awareness and respect. That's why this video matters. I'll show you the 3 key signs to watch for, especially after age 60. But more than that, I'll explain what each one means and what actions you can take if you notice them. Maybe you've already experienced one or more of these signs, but didn't realize it was a red flag. What I'm about to share isn't based on old myths or internet guesses. These are patterns we observe every day in medical practice, backed by the American Urological Association and women's health research around the world. After 60, your body responds differently, and your urine becomes a clear mirror of what's happening inside. Changes in color, smell, or frequency, even small ones, can be signals of something much more important. So now, as a doctor who has walked with many women through this phase of life, I invite you to gently observe the first sign on our list and understand why it deserves your attention. Sign number 1, dark urine with a strong odor. This is one sign you should never ignore. Your urine is noticeably darker than usual and has a strong, pungent smell. It might seem minor. It might seem like something that just happens with age. But let me be clear, it's not. Let's start with the color. If your urine looks dark amber, orangish, or similar to black tea, that's your body raising a red flag. Now let's talk about the smell. If your urine smells strong, ammonia-like, or even sour, like a cleaning product or vinegar, that's the second important sign that something could be off. In my office, I often hear, "Doctor, I just noticed my pee smelled strange, stronger than usual, but it didn't hurt, so I thought it was nothing." And that is exactly where the danger lies. Because not every problem starts with pain. Some start with subtle changes that only a caring eye will catch. After 60, the kidneys don't filter the blood as efficiently. The body holds on to more waste, and the bladder becomes more reactive. What used to pass unnoticed now becomes a warning sign, not to panic, but to pay attention. This kind of urine could be a sign of chronic dehydration, especially common in older women who simply don't drink enough water. Early-stage urinary tract infections, UTIs, even before pain shows up, toxin buildup from medications or processed foods, kidney strain, or overload. But here's the most important takeaway. When these signs show up, your body is trying to prevent something worse. It's not just reacting, it's asking for care before it needs to scream for help. What to check and what to do. Pay close attention to. Color, especially first thing in the morning. Use a clear glass to check. Smell. It should be mild or barely noticeable. Clarity. Your urine should not be cloudy or foamy. Frequency. Sudden changes with no clear reason deserve attention. What to do right away. Increase your water intake throughout the day, even if you're not thirsty. Thirst in older adults often comes too late. Cut back on salt and processed foods for a few days. This gives your kidneys a break and helps flush toxins. Write down symptoms for 3 days. If they continue, talk to your doctor. Seek medical attention if you notice lower back pain, chills, or even mild fever. These could be early signs of a UTI still confined to the urethra or kidneys. Remember, this sign comes before the problem. Those who catch it early avoid medication, avoid hospitalization, and avoid unnecessary fear. Your body knows how to protect itself. It just needs you to listen. Sign number 2, blood in the urine. Even a drop matters. Now that you've learned to recognize changes in color and smell, let's move on to the second sign, one that usually causes more fear. Because when it shows up, most people look away and pretend it didn't happen. But your body doesn't forget. This one is serious. Seeing blood in your urine, even a tiny drop, even if it happens just once, even if it doesn't hurt, it is never normal. In the exam room, I often hear, "Doctor, I thought it was just a small irritation. It only happened once. Then it went away. So I didn't worry about it." But ignoring this sign can be a dangerous mistake. Because blood in the urine, also called hematuria, can have innocent causes. But it can also be the first warning of something much more serious. There are many possible reasons for blood in the urine, including urinary tract infection with bleeding, hemorrhagic cystitis, inflammation of the bladder lining, kidney stones, polyps, or internal lesions, and in rare cases, bladder or kidney tumors. But here's the most important thing to remember. This isn't about fear. It's about being proactive. After age 60, the body often gives quieter signs, and blood in the urine is one of the few visible red flags your body will show you. It's like your body shouting through the only channel it has left. Some women confuse it with light spotting. Others think it's coming from the uterus. But if the blood is clearly mixed with your urine, even just a trace, that deserves serious attention. What to watch for? Color. Urine that looks pink, reddish, or has specks of blood. Frequency. Even if it happens just once, it's enough to warrant checking. Accompanying symptoms. Pain during urination, constant urge to go, mild fever, or chills. Pattern. If your urine is clear for a few days, and then the blood comes back, that matters too. What to do immediately. Do not ignore it, even if it only happens once. Schedule an appointment with a primary care doctor, OB/GYN, or urologist. Avoid self-medicating with herbal teas or home remedies. These may mask symptoms and delay proper treatment. Request a full urinalysis, and if recommended, a renal bladder ultrasound. These tests are simple, non-invasive, and provide real clarity. Pay close attention in the next 48 hours. If symptoms like pain, fever, fatigue, or cloudy urine appear, don't wait. Seek medical care immediately. You don't need to live in fear, but you also shouldn't second-guess your body. Blood in the urine is a clear call for attention, and mature women deserve to be heard and respected, even in the subtle ways the body speaks. It's not overreacting. It's not being dramatic. It's taking care of yourself, and those who take care of it now avoid bigger problems down the road. Sign number 3, urinating frequently, even without drinking much water. Now that you've seen how serious the second sign can be, Let's move on to the third. This one often seems harmless, but over time it can silently steal your quality of life. Sign number 3, constant urge to urinate, even without drinking much. This might be the easiest sign to overlook, and one of the most common among women over 60. It starts as that constant need to pee. Even when you haven't had much water, even during the night, you find yourself waking up once, twice, 3 times at night, and when you go, it's barely a trickle. During the day, even a small sip of water feels like it sends you running to the bathroom. Suddenly, you're planning your errands based on where the restrooms are. If this sounds like you, take a breath. You're not alone. Many women experience this, and because it doesn't come with pain or blood, it often gets brushed off as just something that happens. But here's the truth. It's not normal, and it could be a sign of several underlying conditions. This frequent urge to urinate could be caused by several conditions. Overactive bladder, very common after age 60. Pelvic floor weakening, caused by childbirth, aging, and hormonal changes. Mild but recurring urinary tract infections. And in some cases, early signs of metabolic issues, like prediabetes or mild kidney dysfunction. But here's the real issue. It's not just a physical symptom. It impacts your quality of life. It affects your sleep, your mood, and your confidence. It makes some women stay home instead of going out. They feel embarrassed, afraid they won't make it in time. And slowly, they start giving up the things they once loved. But here's the good news. This can be treated, managed, and in many cases, reversed. But first, we have to stop ignoring it. What to watch for? How many times do you urinate during the day? Normal range, 5 to 7 times. How many times do you wake up at night to pee? More than once may signal a problem. Do you feel urgency even when your bladder isn't full? Do you experience light leakage when you cough, laugh, or lift something? Do you avoid drinking water because you're afraid you won't get to the bathroom in time? What to do right away? Track your bathroom habits for 3 days. This gives your doctor valuable insight into your pattern. Avoid caffeine, including coffee, soda, and energy drinks. They irritate the bladder. Drink water gradually throughout the day. Don't skip hydration out of fear. It makes symptoms worse. Consult a urologist or a menopause-informed OB/GYN. There are simple treatments, pelvic floor therapy, and lifestyle changes that can make a big difference. Frequent urination isn't just annoying. It's your body asking for a better balance. And you deserve peaceful sleep, confidence to go where you please, and freedom to enjoy your life fully. After 60, self-care begins with paying attention to the small things. And yes, that includes your bladder. Now that you know the 3 signs you should never ignore, I want to offer you something extra. A simple daily habit to help you stay in tune with your body. If you've made it this far, congratulations. It means you care about your health, your independence, and your right to feel good in your own skin. And as a small gift, I want to share what I call the Daily Urine Check-In. You don't need a lab. You don't need a device. All you need is a little attention and a clear glass. How to do your daily urine self-check. First thing in the morning, pee into a clear glass. This allows you to see the color, clarity, and smell, calmly and without guesswork. Check the color. Light yellow, normal and healthy. Dark yellow or orange may signal dehydration or kidney overload. Pink or reddish could mean blood is present. Cloudy or milky may indicate infection. Smell it. Almost no smell or very mild. That's good. Strong, chemical, sour, or ammonia-like. That's a red flag. This habit takes less than a minute, but it can give you early clues before discomfort even begins. It's a way to stay ahead, to stay connected, to stay well. Because the more you observe, the better you protect what matters most. Your health, your peace, your life. If this content helped you, consider subscribing and sharing this video with other women who need this reminder. You're not alone. You're not imagining it. And you absolutely deserve to feel safe, strong, and supported every single day. What else to observe during your daily check-in? Color. Almost clear or pale yellow. That's a sign of good hydration. Very dark or amber. That may suggest dehydration or kidney stress. Reddish or pink. Possible trace of blood. Follow up immediately. Cloudy or milky. Could indicate infection. Smell neutral or slightly earthy. Normal. Sharp, sour, or chemical-like. That's a red flag. Something may be off. Foam. A little light foam. Normal. Thick, persistent foam that doesn't go away? That might suggest too much protein in the urine. A possible early sign of kidney strain. Frequency. Do you wake up urgently needing to go? Or more than once a night? That's a sign to keep track of for a few days. A small daily ritual with big impact. This quiet, caring habit can give you something powerful. Body awareness. You begin to see patterns in your body. You start to notice when something feels off, and you gain the confidence to seek help at the right time. Not too late, and not out of fear. Many women believe that caring for intimate health means expensive tests, complicated treatments, or embarrassment. But truly, the first step is simply looking at yourself with kindness. And this daily check-in, it's a gentle, private way to say to your body, I'm here. I'm paying attention to you. You can even jot your observations down in a small notebook. Doctors love when patients bring this. It makes everything clearer, faster, and more personal. Remember, your body is not betraying you. It's trying to talk to you. And now, you know how to listen. Paying attention to your urine may seem like a small thing, but it's one of the deepest acts of self-respect you can offer your body. Because life after 60, it's not the end of anything. It's a new beginning, a time to slow down, to turn inward, to hear what your body is saying, and respond with tenderness. And when you choose to notice, when you stop brushing off the signs, you're saying to yourself, I matter. I deserve to feel well. Your body still belongs to you. Your health is still in your hands. And caring for yourself now is the truest form of freedom. Thank you for being here. You're not alone on this path. You're part of a generation of women who are learning to listen to their bodies and to finally, truly put themselves first. If this video helped you in any way, share it with a friend you care about. Sometimes one simple insight can protect an entire future. Leave a like if this message spoke to you. And in the comments, tell me, which of these signs have you noticed before, but never realized mattered? And if you want to keep learning with me, subscribe to this channel. Every week, we bring gentle, honest, and respectful health advice for women who are aging with strength, grace, and courage. Your health matters, and you deserve to feel good, inside and out.